A reminder, everybody, that net proceeds from our show, Sports Medicine Weekly, go to support orthopedic research at Rush through the LiveActiveNow.org fund. Boy, it's interesting that the IHSA recently released a new calendar that reschedules Illinois high school sports for COVID-related safety reasons, including football, now taking place in the spring. Big adjustment for everybody. And with the sports seasons adjusted, a good question is, how should student athletes train for their seasons after being out of sports for much of this year? Well, let's bring on our next guest, Chuck Thigpen. Dr. Thigpen is the Director of Practice Innovation and Analytics at ATI Physical Therapy. And Dr. Thigpen, thanks so much for joining us here on Sports Medicine Weekly's first question. How should athletes train to prepare for their adjusted seasons after being out of sports for much of this year?
Well, Steve, thanks so much. Traditionally we would ask for a break and talk about resting and be careful what you wish for. We've gotten that, and so I think we're really moving into a time now where progressive preparation is what's going to really allow to keep our kids in the game.
Absolutely. How can they prevent injuries? What should our student athletes be thinking about?
First is just fitness. I think one of the challenges with gyms closed and maybe not able to go to school in our normal training ways, we haven't been able to train like we normally would. So the first thing would just be getting their overall fitness up. That's participating in activities like their sports, or just running on a regular basis as they anticipate the seasons coming back. And then the second would be is to participate in strength training and flexibility in a progressive manner in the 4 to 6 weeks leading up to the new season.
Yeah, I think that strength and conditioning is vital, and it's interesting you say 4 to 6 weeks. That's kind of a nice timeline. Again, we're visiting with Dr. Chuck Thigpen, Director of Practice Innovation Analytics at ATI Physical Therapy. What should parents and athletes, Dr. Thigpen, consider as traditional sports seasons are altered?
I think the biggest thing is things are all out of order. And so now, let's take football, for example, is now going to be played in the spring. And traditionally, we would have in June and July built up to be ready to participate in football in August. And now that preparation is going to take time at a different point in the year. So I think really communicating between their coaches, between their strength and conditioning staff, and then their athlete to understand how are they going to prepare. So, for example, let's say they play track and field and football. Those things are flipped now. They're going to do track and field in the fall and then football in the spring. And so how those athletic participations are sequenced are going to be different. So they're going to need to be ready to sort of address that with the coaches so everybody's on the same page with their kids' plan.
Absolutely. And what should athletes do if they're injured?
If kids are having issues, the first is to stop playing. There's very few circumstances that we really should be playing through pain. And so finding an orthopedic specialist, like an orthopedic surgeon or a physical therapist, to really assess that injury, to help understand what that injury is and lay out a clear framework, because that really allows the athlete then the ability to have a plan to progressively return to sport, resolving their injury and preventing re-injury long term.
And if you can, Dr. Thigpen, tell us what you guys are doing over at ATI Physical Therapy. So many locations here in the Chicago area and within our listening audience. You guys not only take care of the injured, but also those who want to prevent injuries, correct?
No, that's right. Thanks, Steve. So, I think there's really three things that we're doing. One is doing what we always do with our high school athletes. We cover a number of the high schools in the area with our certified athletic trainers. That'll be, when our athletes are able to go back on the field, we'll be right there with them and able to treat them if they get hurt. We do have a virtual physical therapy offering called ATI Connect that we can do an injury screen or a virtual visit during these sort of altered times. And then, of course, we have our in-person locations that we've always had there in the Chicago area where we can provide treatment, do an injury screen, and really help athletes avoid injury and stay healthy.
So ATI Physical Therapy, you guys have athletic trainers in 250 schools throughout the country. How does that work?
So we partner with local high schools to provide a certified athletic trainer on campus to help provide care for their sports in person for things like football and lacrosse that are contact sports, and then in the athletic training room for other sports that may be spread out across the campus or in other areas in the community.
I think that's great. And how about your specific position, Dr. Thigpen? Again, we're visiting with Dr. Chuck Thigpen, Director of Practice Innovation Analytics at ATI Physical Therapy. Where are we going with it? What do you think about when you're planning for the future with ATI?
I think at ATI we're really committed to providing a high level of care that helps patients get better where they are. So for us, understanding what the activity and the expectations of patients are and what they want to be able to do in life, and then to help them get there. So, for example, telehealth in this sort of in-between time that maybe patients don't want to come to the clinic, and really trying to understand what the safety of that is. All of our clinics are super safe. We do the mask and social distancing and just super prepared to see patients in clinic. But we've added our ATI Connect, our virtual offering, to meet patients where they are to allow them to get back to function. And so I've been a part of the team that rolled that out. And now we're trying to think about how do we continue to do that as we move into whatever new normal, and especially if we think about athletes, how do we keep these young athletes healthy as they go back to sports in such a different time?
Great stuff. Dr. Chuck Thigpen, ATI Physical Therapy, continued success with ATI, and thanks for lending your expertise. And let's keep these athletes, let's get them on the field and keep them healthy. What do you say?
No, I hope so, Steve. Thanks for having me.
I appreciate it. Again, Dr. Chuck Thigpen with ATI Physical Therapy. Time for a break on our show. When we come back, I'll be rejoined by Dr. Brian Cole for our Ask the Doctor segment. You're listening to Sports Medicine Weekly, only on 670 The Score.